Breakfast meeting on healthcare financing has taken place with its focus on enhancing the prevention of and preparedness against future epidemics. It advocates the increase in funding of the National Action Plan for Health Security in the 2022 budget. The meeting with partners hopes to advocate moves for the inclusion of NAPHS in Nigeria's health budget in order to improve health security for all Nigerians. Kemi Balogun has more on this, and after this report, there will be business update with David.
The emergence of the COVID-19 pandemic has brought to light the need for not only proper health infrastructure, but also the need to properly fund the healthcare sector across all areas. This has become necessary due to the frequent epidemics that some countries have had to deal with, and also to better prepare for future outbreaks of pandemics. This high-level breakfast meeting with stakeholders is taking place with the major objective of pushing the need for healthcare financing revolving around the National Action Plan for Health Security in the 2022 budget.
Things that became obvious from the COVID-19 pandemic was how much our health systems need to be strengthened and how many gaps there are from the primary health level to tertiary. And investing in preparedness means that healthcare at these levels, at the primary levels, will be strengthened.
Funding is not necessarily around putting money and throwing money into the sector, but also to ensure that the money does the right thing and in effect improves not just the health situation of the country, but also the economic reality of the country.
Nigeria's present health budget is at 547 billion naira for healthcare, which is about 7% of the total budget. Funding has slightly improved in the health sector, but these advocates still believe that a lot more needs to be done.
We believe that significant growth in revenues would guarantee increase in health sector allocation and also direct accretion to the basic healthcare provision.
$80 million invested in health security per year. $80 million, or say 30 billion naira, which could very adequately fund the National Action Plan for Health Security. If this is invested in epidemic preparedness, there would be a return on investment of $9.6 billion per year, or 3.5 trillion naira per year.
There has to be residual money that is set aside. At least the moment the pandemic comes, we lay our hands on that money and the response will follow immediately.
Although the 2021 budget includes provision for funds for managing emergencies and infectious diseases such as COVID-19, it still falls short of the Abuja Declaration pledge and commitment to ensure that at least 15% of its annual budgetary allocation goes towards health care. Kemi Balogun, TVC News, Abuja.